As Chief Operating Officer for American Oncology Network, I have responsibility for overseeing all of the practice operations and a number of support and central services that really will hopefully make those practices more efficient in what they do every day to allow for a better patient experience. Our job and our goal is to really make the jobs for the physicians easier so they can focus on what's most important, which is the patient that's in front of them every single day. So whether it's providing them access to our standing operating procedures, a state-of-the-art technology platform, a robust staff to take away some of the administrative burden for them, it really truly allows them to do what's most important. One of the things that I felt was incredibly important was really to create consistency across our practices. And that consistency is based on creating an optimal patient outcome. So whether it's a person who works at our front desk and how we register a patient, it's how we treat patients in our lab, what the experience should be in the chemo room. It really looks to measure the outcomes of those processes that are hopefully going to be optimal to the patient care and the delivery and the support for those patients moving forward. I think healthcare as a whole is constantly facing a ton of headwinds. Those headwinds could be coming in the form of reimbursement change, it could be coming in the form of regulatory change, and our goal and our objective is always to make sure that community oncology is here for the long term to take care of the patients. We believe that the best care is provided close to home, where patients can get back to work, back to their families. Our value propositions are multi, but really we try to be as efficient and support them on everything on procurement strategies to ensure that, again, we are doing everything we can to procure, whether it's pharmaceuticals, medical supplies, health insurance, medical malpractice, at optimal and being at the best prices possible for them. We try to help them as well by diversifying their practices. We're offering them a number of services, whether it's access to a specialty pharmacy, a clinical lab, hematopathology services, clinical research as a way to, again, to provide a diversified revenue stream for those practices in the event that there is some sort of changes in one part of the business or another. We bring a lot of efficiency, our ability to operate the practice, frankly, more efficient than anyone else through using of our centralized services, whether it's information technology, billing and collecting, general accounting, human resources, legal, coding and compliance, really allows them to operate on a much efficient level by aggregating practices across the board and leveraging that from a centralized perspective. So anything we can do to help really manage those costs on behalf of those patients and our payer partners, we think is a huge win. That really has allowed these practices to be unshackled or removing some of the burdens of running a practice day to day, receive the professional management that comes with American Oncology Network to really focus on what's most important, which is taking care of the patients.